Hello, and it's my pleasure to introduce Ira Miesler, who is a lawyer, and immediately I knew that. I thought she must be a great lady. So she is obviously a lawyer like me. So a few introductory comments. So as you can see, this is about AI and EHDS policy keynote from a member state perspective. And none of you will need reminding from Europe that Germany is a key market for digital health and a very important country in the EU. So first of all, her expertise is very much around health, data protection, and IT law. She is a senior policy advisor at the German Federal Ministry of Health, and she works in Division 511. It almost sounds like a secret service, that. But 511 focuses on new technologies and data use. Ira deals with various legal issues. Her current focus is on the finalization and implementation of the European regulation on the European health data space. So she is the ideal person to talk to us about this. And as a segue from the last session that was emphasizing the opportunities for EHDS. So Ira, over to you.
Thank you so much for the introduction. Thank you for having me. And I will just go right into it because time is very short. So you can go ahead to the next slide because I don't have control over the presentation. I hope you can hear me all right.
Yes.
Okay. So I will just basically cover three topics today. I will very briefly talk to you about the importance of data, because I think you all know of it already. I will talk about what we're already doing with AI in healthcare currently, and we will have a look at the future regulatory landscape that we are facing right now and that we will have to implement, and we are looking very much forward to. So right to the next slide, actually 2 slides over will be fine, the importance of data. So obviously we need data that makes sense, that is valid, curated, and representative for all the purposes that we face in the healthcare sector. So it's not only when we are giving healthcare provision, but also with follow issues like reimbursement or patient management, obviously patient safety, product safety, all this is and connections there. But obviously also from a governance perspective and a policy perspective, we need to look at valuable and data that makes sense to actually know what we're doing. And obviously, because this is a topic also for product development, namely AI development, training, testing, evaluating, validating, all this context, we need data. So to improve our healthcare system, obviously, to transform it into a learning healthcare system that from the patient through data analysis and product development back to the patient, we need data. But the key issue that we always face when we are looking at regulations is what data do we actually need for which purpose? Because obviously, when training an AI algorithm, the algorithm does not need my name. So we can obviously work with pseudonymized data, and it's very important, we're noticing every day, to actually communicate this, that we need data to make products more safe, especially AI, because if we train AI on a databases that does not actually represent the population that it's later supposed to apply to, the data may be false and the actually results will be false. So we need our own data to actually develop correct products. But we people are afraid, especially in Germany, because of our history, when it comes to data use. So we need to communicate that the data being used is not all data. My name will not be there. It will be anonymized or pseudonymized. I will not be recognized. So we can go to the next slides. This is a picture from a publication that was actually, sorry, yeah, I switched the slide recently. So I will just talk about this slide, because when we're talking about using data right now in Germany, and not only Germany, but namely here, we are facing a lot of barriers when it comes to effective data use. A lot of data is not interoperable. We have problems with the data that is in our electronic health record, if we even have them, because most of them are not structured yet. We lack resources. Data is only available delayed, and obviously from a policy perspective, we are facing a lot of legal uncertainties because data protection is interpreted very restrictive here, and because of our federal system, it's also interpreted very differently. So that is issues that we are facing and that we actually have been addressing recently. I will cover that in a minute. So these are issues that we are facing, but we are working towards, with regards to our national legislation as well as the EHDS, to a secure access to linkable health data, to have a more complete databases for further development and further secondary use of data that I will talk about in a minute as well. You can go to the next slide, which is just basically an excerpt from a publication that my colleagues and colleagues from the US made together, which basically points out that we need a data integrity to make viable products and further the use for the patients. And this integrity needs to be thought about at every step during the healthcare system. So basically from the patient, inpatient or outpatient, through research and development based on data collected there, to again collecting clinical evidence and developing guidelines and policy decisions, which will go back to the patients. So this is basically a key point that we're facing and that we already need to address when we collect data at the very first step. So now that we covered all the issues, I will still talk about what we already are doing, despite not all legislation having been changed to actually make this possible. So you can go to the next slide. So yes, AI in healthcare, what we are already doing. So obviously, when we're talking about AI in the healthcare sector, there are many possible applications. So we're talking obviously about disease prevention and health promotion, also about the delivery of healthcare itself. One slide back, please. But also, as I already mentioned, as drug discovery and development of drugs and development. But within these spectrums, we have also different process and steps that we can look at, from surveillance, screening, and to the diagnosis, also through resource allocation and to care triaging and follow-up care. So, and when we are looking at drugs, obviously it starts from discovery to post-market monitoring. So just to remind you where we can use AI in the healthcare sector, I want to show you what we are already doing right now, because if you can go to the next slide, there is many projects that we are already funding through our digital innovations project. The aim of our digital innovations project is to promote and fund research in focus areas to identify specific benefits for AI for patient care. And the most important aspect of the funded project is always the consolidation and utilization of data or distributed knowledge. And we have funded, if you can go to the next slide, you can see it, basically our projects into 4 modules. Module 1 is smart sensor technology, module 2, smart data use, and module 3 is smart algorithms and expert systems, and module 4 is smart communication. What am I talking about here? You can see it on the next slides. Here we've picked, basically, me and my colleagues, our favorite projects that are being funded right now in the modules. So in the smart sensor technologies, our favorite project right now is the sensor-based prenatal care, is Smart Start. It's a sensor-based prenatal care in the home environment. So basically, pregnant women get a device that helps them monitor themselves, which is especially important in rural areas where they don't have direct access to hospital or specialized care. So they can monitor themselves, which helps them to actually identify when they need urgent care or not, which actually makes them more safe and they are taken care of better. In our smart data use, we have Autopilot, which is an yes, basically helps in intelligent allocation of blood products. We have Dr. AI development analysis of algorithms in the imagining discipline of radiology using, and also SCP2, which is smart algorithms to support melanoma diagnostics, which is obviously and a picture, analyzes pictures of melanomas to help support whether it's cancer or not. And we have HICAST in module 4, which is an hybrid AI, which use of hybrid AI language technologies for quality assurance in medical care. So basically, it supports the the health professionals when applying health care. On the next slide, you can see that we have all through Germany, we have funded projects. We are funding projects in 23 of the 38 German university hospitals, and altogether we are right now project partners in more than 40 AI projects that we are funding. This is just to give you an impression. And because of the time, I will quickly move forward to the EHDS that was already introduced, because I believe that the EHDS and what it will bring will actually move forward the possibilities that we already started here. It will be giving more possibilities. So if you go to the next slides, that is telling you basically the issues we are facing on the basis of the GDPR, which is that health data is very sensitive data because it has a great potential for misuse, but at the same time, it's very important. So we need to balance, obviously, how we use health data for the public interest, also developing of AI, but at the same time protect the data subjects, so the individual whose data is concerned. And this is where the EHDS comes in. But the EHDS, as you can see on the next slide, which is a slide from the European Commission, the European Health Data Space is the first European data space of many. And obviously, it's not an actual space where data is stored, but the idea is that you have a regulation frame where data sharing and exchange can be done between partners based on the same standard and rules. And I see there's a slight delay in the slides, so I hope you're not too confused about this because I'm already moving on. The EHDS fits right into the GDPR regulation, the Data Governance Act, also taking note of the recent AI Act. And now the EHDS will also allow us data use for further purposes that we were not allowed before. But if you can see on the next slide, we try to show you that we already implemented the Health Data Use Act. This is supposed to show you that before the EHDS started, we already, or actually the EHDS started, but before we finish it, because we are still working on it now, we already introduced and finished the Health Data Use Act, which basically is a small EHDS in itself, because it allows the secondary use of health data that is already in the healthcare system in Germany. So with regard to secondary use, we are already one step in the direction of the EHDS. I wanted to tell you quickly where we are with the EHDS regulation. You can see it on the next slide. Because we are finishing right now the legal linguistic review, which will then be formally approved by Council and Parliament in autumn and winter this year. And we are looking forward to having the EHDS into force in the first quarter of 2025. Obviously, the rules will apply with a slight delay because we have to actually implement all the infrastructural things that the EHDS brings. So it will apply only after 2, 4, 6, and very small parts only after 10 years. You can go to the next slide, which I already mentioned some. What do we want with the EHDS? The primary use, obviously, will it make easier for patients to receive and have access to their data in primary healthcare, also giving professional a more broad overview over the data there. And also in secondary use, we are enabling the reuse of data for many purposes now without, with a few exceptions, for an consent needed by the patients. Obviously, we are introducing the opt-out as well. So every data subject that does not want their data to be used can opt out. And yeah, these are the main goals of the EHDS, but we are looking forward to a lot of implementation issues, because as you can see on the next slide, and I know I'm running out of time, I'm very sorry, these are the data categories that we need to attach to the EHDS. And you can see it's a very broad scope. I'm not going into everything. I just wanted to show you this is a very broad spectrum that we are looking at. And obviously, we have a lot of infrastructures already in place, but we are still missing some. And we are right now identifying where the gaps are to implement this within the 4-year period that we are given. On the next slide, I want to highlight again the purposes that we are now allowed for data use, which does include scientific research, including training, testing, and evaluating of algorithms, including AI systems. So what I was talking about earlier will be made easier when the EHDS is in place. But, and this is the most important thing and the biggest change, especially in Germany, we are now allowing access to data based on their purpose and not based on the data user that is applying for said purpose. So I see I'm running out of time, and I wanted to allow a few questions. So please, can you skip to the second to last slide, please? Because what we are looking at, what we are envisioning, two further, please. What we are envisioning for our system is an interconnected healthcare system that is an ecosystem where you connect data holders based on certain data categories and connect them through secure processing environments, through the health data access bodies that give permits for data use and allow data users to use data and actually exchange them. So yes, what we wanted to make clear here that a learning healthcare system needs a data ecosystem that we are building now, and we're using the EHDS as a platform to go further in that direction. And the EHDS has the potential for better health data use, including for AI. But as I said in the beginning, it is important to communicate health data literacy and empower people to understand what is actually happening. And yes, this is the message that we want to put out there. Data use is important, but also it is important to make that clear to the individual so we can use their data. So I'm sorry for overstepping here in time. Thank you so much for giving me this opportunity.
Ira, thank you. So a quick question. Many people will know that Germany is a federal country. Looking at the implementation of both EHDS and AI, do you think that it will be just federal in this sense, or is there going to be implementation at state level? And is there a risk, therefore, that will lead to some fragmentation or different interpretations, do you think?
So we are trying to implement it on a more national level, because this is basically it's a mix where it comes to competency, but we have the chance to make it on a federal level, encompassing all states' general rules. But when it comes to interpretation and application, it's still within the individual state. So there's still a risk that it will be applied slightly differently, but we are working very hardly on a unified approach.
Brilliant. Thank you. We're just coming up to, so thank you very much. Fascinating insight.
Thank you.